So since it's National Breastfeeding Awareness Month, I thought I would talk a little bit with you about thyroid medication and breastfeeding and the safety of it. So if you could do me a favor first, if you could go ahead and subscribe to my channel and then hit that bell so you get notification every time I release a new video. So I often wondered about this myself when I had my son. Is this thyroid medication safe? Is this okay for me to take this while I'm breastfeeding? As you know, as a breastfeeding mother, you need to be mindful of everything that you use, everything that you take, because it can pass through your milk and obviously it can go to the babies. So it's natural to kind of wonder, what about thyroid medication? What do we do with this? So first and foremost, if you are taking thyroid medication, you definitely need to have this discussion with your prescribing physician. I know that can be a challenge sometimes, but it is something that I would still consider talking to them about more often than not. In my experience in working with a lot of women who are breastfeeding and taking thyroid medication, their doctor says, yeah, you absolutely need to stay on this. Now, there are definitely some medications that are ill-advised that you do not want to take as a nursing mother, but thyroid hormone replacement drugs used to treat underactive thyroid, so hypothyroidism, even including Hashimoto's disease, are kind of an exception. In my experience, I have seen that women still need to stay on this. Again, needs to be a discussion with your doctor. But one thing to consider is that adequate thyroid hormone is absolutely necessary for normal lactation and for maintaining that normal supply of your breast milk, that sufficient supply of breast milk. So a lot of women, without having their thyroid hormones, they actually can't breastfeed. So just kind of consider that most women actually need those thyroid hormones. And so if you have to get it externally from a medication, you may have to do that. So just kind of consider that. The other thing that I think you also should have a discussion about is the type of medication. So if you are taking a medication that has a bunch of fillers in it, things that your body may not tolerate the best, like gluten. I talk about this a lot, especially on social media recently, because I've been getting a lot of questions about that. Gluten is in some thyroid medications. So something like Synthroid, levothyroxine, the typical medication they put you on for your thyroid, most of the time that has gluten in it. If you have something like Hashimoto's, gluten can cause a flare-up. Gluten can cause a lot of issues. So that will pass on to the baby. So just consider that you may need to have that discussion with your doctor about, one, the type of medication and even the dosage. Maybe the dosage is too high and you need to drop that down. Maybe you actually need some T3 and they only have T4 in it. And then obviously, like I said, you're taking a medication that has a bunch of fillers in it that you don't necessarily want to pass on to the baby. So that is something that I absolutely would have that discussion with your doctor about, is the type of medication and even your dosage, and see what they say, because it's always worth a discussion. Like I mentioned, most women, they need those thyroid hormones for that sufficient supply of milk and lactation. And if you don't have that, it is going to be harder to breastfeed. So there are, like I said, medications that you absolutely don't want to take while you're breastfeeding, but thyroid hormones, in my experience, women actually need those. So definitely a discussion with your doctor. Make sure that they're obviously still on board with you taking that. The majority of the time they are, but just be mindful of the type of medication that you're taking, and that would be a discussion that I would have. And then the other part of it is be sure they're checking your markers. Be sure you're getting a full thyroid panel. That full thyroid panel will be very, very helpful in order for you to monitor, because remember, after you have a baby, everything changes, and you know that. All the sex hormones, everything is kind of out of whack. So thyroid is no exception. That can kind of get out of whack a little more post-baby. So have them monitor that, because that will also change the thyroid medication. Your dosage might be completely different. You might need more T3 or less T3 if you were taking it, or even T4. So make sure they're monitoring that full thyroid panel, meaning they need to check TSH, free T3, free T4, reverse T3. That's not one they will commonly check, FYI. And then your thyroid antibodies, TPO and TGAB. Very important to check thyroid antibodies post-baby, because those typically get out of whack after having a baby as well. So make sure they're doing that, and that will also help kind of guide you into making your decision on, is this safe? Should I still keep taking this thyroid medication? So let me know if you have any questions or comments below about if you're experiencing this as well with taking thyroid medication. I would love to answer any questions you have. And I also can drop a link below as well If you would like my guide, that's called The Secret to Reading Your Thyroid Blood Test. So it goes over the markers that I just mentioned, why you need them checked, what they are, and then even the reference ranges that make you feel more optimal. So I will drop that link below so you can grab that guide. Again, let me know if you have any questions. I will see you on the next video. Bye.